Hello, my name is John Lampard. I've been asked to speak on behalf of Southwest Arizona Futures Forum about the demographics and all numbers related to disease and death for Yuma County, to discuss what the county is struggling with and help you determine some topics for discussion today for the forum to help cultivate and develop a healthier Yuma. So through this process, we first looked at some numbers on Yuma to understand what the population is looking like. And then we looked at the primary care medical network to see what level of service the population had, some hospital data, and some benchmarks that were available so that we could understand the population and have some things in consideration when looking for issues that the community struggles with regarding diseases and death. I'm going to take you through some of that progression today and hopefully leave you with some topics to discuss for the Futures Forum. With that, let's move on to a discussion of the population. Yuma County has about 200,000 year-round population. In addition to that, they also have about 41,000 seasonal farm workers that come in from California, 50,000 Mexicans that come on work visa, about 83,000 winter visitors known as snowbirds, and about 1.3 million day tourists annually. We're going to come back to the slide. Let's take a quick look at the distributions of those populations. Now, the agricultural workers are coming in December and leaving end March, beginning April. In January and February, the concentrations reach their height. Like the agricultural workers, the snowbirds are also coming in end October and leaving by mid-April, with the highest concentrations in January and February. Tourism is pretty flat throughout the year with small peaks in February and March. So what you can take from that is that the 200,000 population almost doubles for about a quarter of the year, particularly in January and February. Today we're going to speak in terms of the 200,000 year-round residents because of the volume of statistical data that's been collected on that population. It's a little bit harder to nail down data on tourists, so we will keep our conversation to the year-round residents. Looking at any population, you typically have a distribution where so much of the population are children, so much of the population are elderly. And so we took a look at that for the state and the county here. And what we found was that there were more youth in Yuma County. The portion of the population that was under the age of 19 was about 11% denser than the state distribution. Looking at the middle-aged residents between age 45 to 64, it's about 14% less dense. And looking at the elderly population, it's about 17% denser than the state population. So what you can take away from that is that for Yuma County, there are notably more young people and elderly people. Let's go back to that slide for a moment. In addition to the distribution, we also have a racial breakdown to discuss. Yuma County is predominantly Hispanic, with about 60% of the population being Hispanic and about 36% being white, non-Hispanic ethnicity. Moving on to poverty, 1 in 5 residents in Yuma County is below the poverty line, earning income below the poverty line. 1 in 4 Hispanic residents would be below the poverty line. What does that mean? Well, every year the Office of Management and Budget defines the poverty level, and they do that based on family size. To put that into perspective, for a single person If you earn an income of less than 11,170, you would be considered earning an income below the poverty level and thus impoverished. To define low income, we would take 2 times that poverty level. So an income of 2 times the 11,000 there, so 22,340 would be a low income level, and anybody below that. So let me rephrase. About half of the population is earning income below that low income level, below the 22,340 for an individual. If you take the 20% of the population that's impoverished out of that, that leaves you with 50 minus 20 is 30. So 30% of the population is essentially low income in this area. That's a key statistic because the government health insurance programs phase out after the poverty level. So they're covering that first 20%, and then that 30% of the population has to figure out how to juggle their constricted budget with the need to cover healthcare. Now, frequently uninsured low-income residents' ability to pay for services renders further strain on the medical network, not just with the ability to pay, but they often postpone seeking medical attention, which exacerbates health problems, creating a larger demand on the community's resources, such as the emergency departments. Moving on to unemployment statistics. As you can see from the map here, when the market bottomed out in 2008, unemployment drastically increased throughout the state. It's been slowly decreasing ever since then. The state average for unemployment last year was 8.3%. In Yuma County, the unemployment rate was 27.5% last year. Among Hispanics, unemployment rates are usually about 120% of whatever the general population is facing. So the projected unemployment rate for the Hispanics would be about 33%. Looking at the second graph there, you can see Yuma's unemployment. It's highly seasonal with the growing season. And you can see, unlike the state, which has been recovering since 2010, you can see that Yuma has unemployment rates that continue to rise. Moving on to education, more than half of the residents in Yuma County have a high school education or less. And when you compare that to the counties with Phoenix and Tucson, you can see a notable difference in education rates. Looking at 2011 data, we see that for grade school levels, almost all of the residents are in those age ranges are enrolled in school, in line with state and national rates, pretty close to 100% enrollment there. And then once you reach the college years of 20 to 24, you can see enrollment drops to about 20% of the population being enrolled in school. As you can see from the chart there, national and state levels are right around 40%. So Yuma's college-age students still enrolled is about half the state and national level. Looking at uninsured statistics, 20% of the population is uninsured. Under the age of 18, about 16.3 are uninsured. And when you look at adults age 18 to 64, close to 30% are uninsured. After 64, Medicare would kick in with hospital insurance and medical insurance. As I spoke of earlier, Medicaid and government insurances would cover up to the poverty line unless there were children or disabilities involved. So the low-income residents above the poverty line would have to figure out how to balance out healthcare needs. And in addition to that, because of state budgetary crises, Arizona has frozen new enrollment into their Medicaid program, So that solidifies that the low-income residents in Yuma would have to look elsewhere for healthcare needs. Women have higher insurance rates. Among the whites, about 1 in 5 are uninsured, and among the Hispanics, about 1 in 4 are uninsured. Final set of statistics on the population here would be looking at birth rate. In general, the birth rate for women aged 15 to 50 is about 20% higher than the state level and 30% higher than the national level. 11%, so more than 1 in every 10 of those births, are born to teenagers. 78% of the births are born to women aged 20 to 34, and about 11% of the births are born to women 35 and up, which shows you that in Yuma, women are having their children earlier in life. Looking at the teenage birth rate, the rate for teenagers is 40% higher than the state level and 80% higher than the national level. A similar trend exists with the 20 to 34-year-olds, where the rate exceeds the state level by 30% and the national level by 40%. Other key statistics regarding in relation to birth would be that 1 in every 3 births are to foreign-born women. 20% of the births are to single working moms. About 1 in every 3 of the births are to women with less than a high school education. And the impoverished population, as we saw before, is disproportionately larger in Yuma County than the state and national levels. And in addition to that, those residents are bearing notably more children in Yuma County. So that gives you a good overview of what the population is looking like. Moving on from there, we want to kind of survey the scene with healthcare in the area, and then look at a little bit of hospital data and a few benchmarks to kind of find some things to keep into consideration when looking for issues that Yuma faces. After we review that, we'll move on to what people are struggling with disease-wise, what they're sick from, and what they're dying from. So, looking at the quality of healthcare, primary care, which would, in addition to hospital coverage, include your family doctors, general practitioners, internal medicine, pediatrics, and obstetrics and gynecology. They provide a platform of basic healthcare for the community. Now, the government realizes that certain areas have more of a difficult time attracting and retaining providers. So they've set up programs to recognize shortages in communities, and then once those shortages are recognized, provide benefits such as grant funding to help attract and retain providers to those areas. Now, this was a quick way to look at the level of care in Yuma. And what we found from this primary care map here is not only Yuma, but the entire region is facing shortages of primary care providers. So there are not enough providers to meet the needs of the population. Furthermore, as you can see here, beyond 90 minutes driving distance, there are no areas that, all areas within 90 minutes driving distance also have recognized shortages to the population. So there would not be a neighboring medical network that could supplement the needs of Yuma County's population, meaning that there is a shortage, and that shortage is lasting. It's unalleviated. Now, the shortage in primary care extends also to mental and dental health, where there are not enough providers in those expertise either.